I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More Here.
Welcome to this episode of IDD Health Matters. Our guest today is Liz Weintraub. Welcome, Liz.
Thank you.
So, Liz, you work with AUCD, which is, tell us about the organization and tell us about your role in the organization.
It stands for the Association for University Centers on Excellence in Developmental Disability.
Association for University Centers for Excellence. Disabilities. Great.
On disability.
On disabilities.
And what I'm saying, excellence is that we have 62 centers around the country.
Okay.
And the territories, of course, because they're part of the U.S.
Sure.
And we represent them. So our members are here at the conference all over the country and the territories, and they are kind of the hub between the for information and on the disability community to and the community at wherever you're living.
Okay.
Like, where are you from?
So I'm from North Carolina.
There's you said, and we're based at the university. So I think it's North Carolina Chapel
Hill.
Okay. And they connect the community to disability.
So this is a place where in any state you can go and find information and guidance about lots of different topics related to disabilities and supporting people with disabilities?
Yes.
Okay.
Yes.
And what is your specific role with the national organization?
My role is to, I'm on the policy team, so I go up on Capitol Hill to advocate for people with disabilities.
All right. Liz, what are some of the hot topics right now that you're advocating for?
Healthcare, healthcare.
Healthcare?
Yeah.
Health equity?
Yes.
Okay.
Which I love because I love to say all means all.
Yeah, all means all. I love that. Yeah.
And if it has to mean all means all. We're working on getting rid of 14C, which is sub-minimum wage. We're working on, although it hasn't really done anything in Congress, on the home community-based services, all the bills around that to make sure that people can stay in their homes and get the support that they need to live in the community.
Okay. And
that also includes health care.
It does, doesn't it?
Yeah.
Going back to 14C, you said that's sub minimum wage, so saying that people with any ability should get paid the same for the same job, right?
Yes.
Yeah, yeah.
And actually right now, the Department of Labor is looking into that.
Excellent.
To get rid of 14C.
Excellent. So when we're going back to healthcare, are there specific things that you're working towards to improve health and health equity for people with disabilities?
People have the autonomy. I can't pronounce that
Autonomy.
word. Yeah.
Yeah.
To control their own health care.
Okay.
And I'll give you an example.
Yes, please.
When I was diagnosed with diabetes about probably five years ago, my husband and I went to a nutritionist, because there's all kinds of rules about what you can eat and what you can't eat, and we didn't understand it, and it was hard to understand what's going on and
Sure.
why. And so it needs to be in plain language.
So when you say plain language, we're talking about providing health-related information in language that anyone can understand,
Yes.
right?
Yes.
Yeah, that's an important component of providing health care, is being able to communicate with all of the people that you're providing health care for in a way that they can understand.
Yes. And I have a YouTube show called Tuesdays with Liz, a disability policy for all, where I make sure that things are in accessible ways.
Right.
So I interview people about the health community-based services, or I interview people about education or whatever.
So what's the name of the show again? Tuesdays with Liz?
Yeah.
Great.
Disability policy for all.
Disability policy for all. Okay, make sure you check that out.
Yeah.
Okay. So how about in your, how did you come to be an advocate, a self-advocate?
Well, I really just wanted to help people
Gotcha.
with disability, me and my friends. And it was kind of a selfish move.
Wow.
I think
I don't think selfish.
I think all decisions are based on you. And so I became a self-advocate, which is just advocating for your own needs. And I wanted to move out of the institutionalized life place. And I didn't know how to speak up for myself.
So you were living in what type of place?
Like-
An institution?
Like
Like an institution?
Yeah.
Okay. And you wanted to move out?
Yeah.
And so how did you make that happen?
I went, and one of the greatest part about a self-advocacy group is that you have people in the group that have the same issues that you might have. And a friend of mine said, I did this, I did that. Why can't you do that? And one of my mentors is at this conference, and she helped me raise my hand when I wanted to speak up, and when I wanted to be a part of a committee. She just grabbed my hand and raised it.
And it helped you out, yeah. So do you live in a place where you want to live now?
Yes.
And are you doing the work that you want to do now?
Yes. I love
That's
for
fantastic.
AUCD. And
That's
the
great.
great part is that I love helping people with disability to understand about policy. And one of the things that I'm really passionate about, and there's 10 students with a staff person that goes to college, just like, and there's a program that is funded by the U.S., the Department of Education, called the TEPSID programs. And they go to college just like anyone else, and take courses just like anyone else. I was with a student last night, and he was saying that he takes some kind of science, physical, anyway,
Okay.
and it's just like, and we're teaching them how to advocate for themselves, and they'll go up on the hill.
So is this the same type of program that we call inclusive post-secondary education,
Yeah.
IPSE? Okay,
Yeah.
gotcha. I know exactly what you're talking about. Yeah, that's a wonderful program. And more colleges are developing programs like this, right?
Yeah, so
Yeah.
there'll be 10 students with their staff who will go up on the hill to advocate for more money for IPSE programs.
That's excellent.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So, Liz, you've done a lot of advocacy work, it sounds like, and not only for yourself, but for a lot of other people as well.
Yeah.
One of the things I like to do on the show is ask a guest to tell me 3 things that they would like the world to know about supports and services or things that they can do to help improve health and wellness or the lives of people with intellectual and developmental disabilities. So what tips do you have for everybody?
Well, healthcare should be for all. Healthcare should be for all, and I mean all. And I mean from language that I understand. When I go to doctors, my doctor is very patient and very good about things, but not everyone is. They talk about things that I don't understand, or they talk to my mom and dad
Instead of to you.
and it's my health care. And yes, mom and dad might, or somebody, a drug care worker, might be concerned about me, and that's great. And we need that. But I'm the patient.
Yeah.
You need to talk to me like we're doing now. You're not talking to my friend Denise.
You're not talking to somebody else asking them about what you think.
Yeah.
I'm actually talking to you, right?
The other issue about health care, I think, is it's complicated.
It is complicated.
So you need to be patient with me. You need to help me. And maybe that's also foreign language. I don't know.
Yeah. So you said, speaking to you, of course, and not to other people around you, or at least to include you in the conversation, the person who's the patient, and then speaking in a language that people can understand, that everyone can understand. Yeah. Is there a third thing that you'd recommend?
I think you need to help people to understand about what does healthcare mean? What?
Yeah. What does good health mean in
Yeah.
life, and how important it is to helping you be successful in other areas
Yeah.
of your
I
life?
can tell you that diabetes when I got diabetes. I didn't understand that I shouldn't be having potato chips and having dessert every night. I could maybe have dessert one night. Or do you want the apple or the
Candy bar.
pie
Right.
or the candy bar? You can't have both.
Right. So I think what you're describing here is something that I talk about a lot, where I believe that anyone with or without a disability should be able to go to any doctor's office, any hospital, and receive a basic level of competent and compassionate health care.
Yeah.
That's health care for all.
Yes.
Yeah. Liz, thank you so much for talking with me today, and I look forward to seeing more of what you do and the work that you do in this field, and thank you for the incredible work that you do.
Thank you, and have a nice day. And health care is for all.
Health care for all.